branches. Then what I look for is the diaphragm. So there's my diaphragm. Because the minute I pass the diaphragm, there are going to be two arteries that we need to identify. So point of reference now that becomes important is the diaphragm. So there's my diaphragm right there. Alright? And I gently clean, and there I'm going to see two arteries. And they are going to be covered by, oops, I just broke one of them. And they're going to be covered by these thin threads right there, folks. And those threads are tons of sympathetic nerves. And in fact, one of those bundles are going to look like a little sesame seed right there between those two blood vessels. And that sesame seed is called the celiac plexus that I pointed out in the lecture in chapter 16. Right, so we can see that down there. All right. Now, what are the two blood vessels? The first one, right under the diaphragm, is the celiac artery. So there's the celiac artery right there. And the celiac artery, notice, is going to have three big branches coming off of it, or three major branches. Right, there we go. So there we can see it right there. So there's my celiac artery right there. So the celiac right there. And then the branches, the first one dips under, there's my stomach. So the first one right there dips under the stomach and runs into the liver. Dips under the stomach, runs into the liver. And liver, pertaining to the liver, is hepatic. Right, so the hepatic artery. Then the second one right there runs to my stomach. And pertaining to the stomach is gastric. And then the third one runs up to the spleen right there and branches, a couple of branches to the spleen, and that is called the splenic. Right there. Now there's a couple of other branches, the pancreatic, but we've just looked at the major branches. So there's celiac right there, and then the branches is to the liver, hepatic, to the stomach, gastric, and to the spleen, the splenic. Right? So that's the first branch right there. Then we have the second branch. And the second branch is called the superior mesentery. Superior mesentery runs right there. And the superior mesentery runs to the small intestine. So there's my small intestine. All of this is the small intestine. And all of these right here are branches of the superior mesentery artery right there. So superior mesentery feeds oxygenated blood to the small intestine. And this membrane right here, folks, that is called the mesentery. So when we do digestion in 2 weeks' time, then we'll talk about the mesenteric lymph nodes, etc. Alright?
So is that this bubble? It's kind of...
So the bubble would be the mesentery,
yeah,
right? Okay, then coming out of the small intestine, you're going to look for a brown blood vessel. Right there. I think some of you are going to have it better than me. Where is this? Okay. Right there it is. There it is. Okay. All right. What you're going to look for, folks, is coming out of the mesentery of the small intestine is going to be a brown vein. And that vein is always going to be brown because it's called the hepatic portal vein. Alright? The hepatic portal vein. So let's regroup. We saw the celiac and the three branches. We saw the superior mesentery going to the small intestine, which is going to be the pink. Right? Now all of the brown is going to be branches of the small intestine. That flows right there into this big brown vein right here called the hepatic portal vein. Now remember when we looked at the endocrine system, the hypothalamo hypophyseal portal system, what did we say with portal structures or portal veins? It is deoxygenated blood but it's carrying beneficial materials. The hepatic portal vein is carrying digested nutrients from the small intestine to the liver. So it's deoxygenated blood, chock and block full of glucose and amino acids. Okay? So make sure you see between the celiac, the superior mesentery, you're going to see the hepatic portal vein as well. And it's a vein, it's brown in color because we can't get blue paint into it because it's a separate little blood vascular system, right? Okay, now let's continue on, all right? So now we continue on down with the aorta right there. And notice again, artery, lumen is smaller than the vein. So there's my aorta, and there, running into my kidney, is the renal artery. Oxygenated blood, but full of metabolic wastes, a la bilirubin, as an example. Right? The aorta continues down, and then in the lower part of the abdominal pelvic cavity, it is going to run into the large intestine right there. And that running into the large intestine, that is called the inferior mesentery. Superior mesentery, bigger to the small intestine. Inferior mesentery, smaller to the large intestine. Right? Then we are pretty much the same as what we were in the lower pelvic area with the vein. Because there we're going to see the branching. And we're only going to look at the first branching. There's two sets of branches. We're only going to look at the first one. And that is called the common iliac. Common iliac in the body cavity by the iliac bone. Then when it comes out of the body cavity, what do we call that right there? Femoral vein, femoral artery. Then there